Hello everyone, and thank you for watching my presentation. I'm excited to share a bit about my practicum experience at Family and Children's Counseling Services, or FCCS, an agency that truly embodies the mission and values of social work practice. Throughout my presentation, I'll give you an overview of the agency's history, the services we provide, the population we serve, and my role as an intern. I'll also reflect on what I've learned so far and how this experience has shaped my understanding of the social work profession. Agency history. FCCS is a relatively new organization with a strong foundation. It was established in 2020 through the merger of two well-respected agencies. The Family Counseling Services of Cortland County, founded in 1971, and the Family and Children's Society, based in Broome County. The merger was more than a simple administration move. It was a strategic decision to combine resources, expertise, and community reach to better meet the increasing demand for behavioral health and family services in central New York. Before the merger, Family Counseling Services of Cortland County had a long-standing reputation for providing affordable outpatient behavioral health services. Over the decades, it expanded to include chemical dependency programs, mental health counseling, and specialized community initiatives like Cortland Prevention Resources and the Cortland LGBTQ+ Center. Meanwhile, the Family and Children's Society brought decades of experience in family therapy, child abuse prevention, and community outreach. Together, these two organizations laid the groundwork for what FCCS is today, a robust, community-centered agency with a holistic approach to wellness and recovery. Services. Since the merger, FCCS has experienced tremendous growth. We now serve clients across Broome, Cortland, Madison, and Tioga counties, and we've expanded our presence through school-based counseling programs, mobile outreach, and telehealth services that make mental health support more accessible. Some of our key services include mental health counseling for children, adolescents, and adults, school-based counseling programs that integrate behavioral and health services directly into schools, the Journey Project, which provides trauma-informed care for child victims, siblings, non-offending parents, and those with other sexual behavior issues, integrated outpatients programs that support clients with both mental health and substance use challenges, telehealth counseling, which offers a greater flexibility and privacy for clients, substance use disorder counseling and medication-assisted treatment, rapid opioid assistance in recovery, or ROAR, which is addressing urgent needs related to the opioid epidemic, the LGBTQ+ Center, which offers services and support groups, outreach and engagement programs for individuals who may struggle to access services, and prevention services, which aim to build healthier, more resilient communities before crises occur. FCCS is committed to providing wraparound services that meet clients where they are, emotionally, socially, and geographically. Our population is diverse and includes children, youth, adults, and families who are navigating emotional, behavioral, or substance-related challenges. We serve individuals from all walks of life, including those facing poverty, trauma, family instability, or barriers to accessing care. FCCS's mission beautifully captures what we stand for: to support and strengthen individuals, families, and the community by building resilience and promoting health, happiness, and recovery in all aspects of life. This mission resonates deeply with me as a social work intern. It reminds me that every interaction, whether it's a counseling session, a phone call, or a community event, is an opportunity to promote resilience and hope. We operate from a strengths-based perspective, emphasizing client empowerment, dignity, and self-determination. In practice, that means helping clients recognize their own capacity for change and supporting them in building the tools they need for long-term recovery. Agency framework. FCCS operates under the guidance of a board of directors made up of professionals from various fields: mental health, education, business, and community leadership. This diverse leadership ensures that our policies and priorities reflect both professional expertise and community needs. At an administrative level, we have a leadership team composed of regional and program directors who oversee specific service areas such as mental health, substance use treatment, prevention, and family services. On the ground, our staff includes social workers, behavioral health clinicians, case managers, outreach specialists, and prevention coordinators. Each of these roles play an essential part in our holistic approach to care. Collaboration is at the heart of our work. Clinicians consult with one another regularly, and multidisciplinary meetings ensure that clients receive coordinated, person-centered care. Currently, FCCS is working towards becoming a certified community behavioral health clinic, or a CCBHC. This certification will allow us to expand our capacity to deliver integrated, comprehensive, and timely care, especially to clients who are high risk or high need. The CCBHC model also enhances access to care coordination, vocational assistance, housing support, and trauma-specific services, all of which align perfectly with social work's holistic philosophy. My role in learning as a social work intern. Now let me talk a bit about my role and learning experience as a behavioral health intern at FCCS. My day-to-day responsibilities vary, but they often include shadowing licensed clinicians, observing therapy sessions, and gradually taking on a small caseload of individual clients under supervision. I also assist with intake assessments, case documentation, and participate in team meetings to discuss treatment planning. One of the most valuable aspects of this internship has been witnessing how theories translate into practice. I've been able to see firsthand how clinicians apply evidence-based approaches such as cognitive behavioral therapy and dialectical behavioral therapy, as well as trauma-informed care, to help clients manage symptoms, regulate emotions, and build coping strategies. I've also learned that social work requires self-awareness and emotional regulation. Working with clients in distress can be emotionally challenging, but the supervision and team support at FCCS has helped me build resilience and confidence in my growing role as a clinician. To wrap up, my experience at FCCS has been both educational and deeply meaningful. I've had the opportunity to develop my clinical skills, better understand the dynamics of a community-based practice, and witness the power of human resilience. FCCS's commitment to accessible, client-centered care aligns beautifully with the core values of social work: service, social justice, dignity, and worth of the person, and the importance of human relationships. As I continue my journey, I'm inspired to carry these values forward, not just as a student, but as a future professional dedicated to creating positive change in people's lives. Thank you all for listening.